magical? I mean, was it that magical? Let's give them a round of applause. I truly did not want it to end, but we have some amazing speakers coming up next. Today is filled of mentors of mine. Dr. Maya Rockeymoore-Cummings, the wife of the honored, beloved Congressman Elijah Cummings, and also wrote the foreword to my book, History of the Black Dollar. This woman is amazing. She is the founder and creator of the Center for Global Policy Solutions, and I am so honored to have her join us today. She is going to be interviewed and have a nice girl chat about if racism is a public health crisis with Rebecca Obounou. I hope I'm saying your name right, beautiful. And she is the Assistant Dean of the School of Innovation at MIT. So once again, honored to have you ladies. Thank you so much. I will now turn it over to you.
Thank you, Angel. I would like to make a quick correction to my title. I am the Assistant Dean of Social Innovation at the Public Service Center at MIT.
So thank you, Angel. It's a pleasure to be on with you as well. And so I look forward to this conversation, Rebecca. Let's go.
Yes, absolutely. Well, Maya, I was looking at your story, and it's fascinating. And I would really love to learn to hear you share it in your own words, your civil rights story and your journey to today in political career as well.
Oh, sure. Thank you. Well, you know, I think that I would like to start with a story that's told in my late husband's recently released book, We're Better Than This, My Fight for the Future of Our Democracy. He talked about a story of his grandfather, who was a preacher. He was a child of two preachers, but his grandfather was also a preacher. And one day he was preaching and he fell ill in the pulpit, and the congregants took him and wheeled him, and they were in South Carolina, his family was at that time, wheeled him to his home, and they put him on the bed. And later, two doctors showed up, two white doctors, an older white doctor and a younger white doctor. And they went in and they examined Elijah's grandfather. And this is his father recounting the story to Elijah, which Elijah then recounts in the book. And then they didn't notice Elijah's dad, who was a boy at the time, sitting on the outside porch. And so they walk out, and then they're talking to each other. And the younger white doctor says, you know, this man needs some help. If he doesn't get, you know, such and such and get to this place, then he's going to die. And the older doctor says, don't worry about him, boy. He's just a nigger. And so, you know, the whole notion of physicians who have taken a Hippocratic oath, of you know, people who are in positions of authority in society, in a position to make a difference, in a position to save lives, in a position to you know, distribute resources in a way that will support communities, having and being infected with this notion that some lives are fundamentally undeserving because of the color of their skin, is infecting everything that we see around us, including the attitudes of people who are supposed to be saving lives. And so when it comes to public health, and so, you know, in terms of my own story, my parents grew up in the Jim Crow South. What made my life different is that, you know, my dad went into the Air Force, and we traveled literally 20 years of his career all around the country and the world. We had healthcare, because military service people have access to healthcare and dental care, and you know, the amenities that are on military bases and that surround military bases are ones that support health. And yet you step off of the military base and go into communities like the one I live in now, Baltimore City, or St. Louis, Missouri, or Chicago, Illinois, or Dallas, Texas, or Los Angeles, California. And you see in many small towns in between, because there's a rural dynamic to this as well that intersects with race and class. And what you see is the systematic deployment of that racist perception in everything from how communities are treated, whether they get the investments they need to have the amenities they need to support their full health, whether or not they're getting the services that they need to support their full health, whether or not they have even access, because there is an intersection of class here that's all tied up into our capitalist society. And as we know, we just talked about the racial wealth gap and how African Americans and Latinos only have 5 and 6 cents respectively of wealth for every $1 of wealth held by the typical white family. That's historic in nature, and it carries out and plays out in our pocketbooks to this day. The intersection and the choice to make critical access to things like quality healthcare dependent upon your ability to pay, fundamentally and by design, leaves people who are disproportionately Black and brown without that access to quality care. Add that on top of the negative treatment, the unequal treatment in the healthcare system, in communities, the way communities are designed, how we segregate people in communities, and you've got just a massive problem. Now, let me just say this about my professional career. I chose to become a political scientist because I wanted to know how to use the tools of politics and policy in order to make a difference in the lives of human beings of all backgrounds, but especially those who have been marginalized historically. And so that has taken me to some incredible places, and one of which was for 10 years, I actually led a $16 million initiative of the Robert Wood Johnson Foundation called Leadership for Healthy Communities, which was a massive public health initiative that was focused on how we actually confront childhood obesity prevention. And what we found out along the way is that you can't just talk about what you eat. You got to talk about the amenities that surround you. You know, what's your housing situation like? How safe is your community for walking and biking? Do you have access to public transportation? I mean, do you have, are you disproportionately targeted for, junk food or junk drinks? All of these things that go into play in terms of determining the quality of our health. So if the answer or the question is, does racism actually create a public health crisis? The answer is absolutely yes.
And would you say, Maya, that racism is the cause of only a public health crisis, or do you think there are other crises that racism also is an underlying factor of?
Oh my gosh, it's the wealth crisis, it's the health crisis, it's the housing crisis. It's the jobs crisis. I mean, literally across the board, racism infects. I mean, I think we heard it from the panel earlier, but African Americans make approximately just 69 cents in terms of earnings, income from work compared to white Americans. That is, the systematic. When we're talking about adding gender to that, it's worse because, for women of color, their numbers are, even more dire when compared to white women and then compared to white men. And so, it's absolutely affecting every aspect of our being, and it's undermining not just our health, because you look at the statistics in terms of type 2 diabetes, and by the way, a lot of people tend to think of these as personal choice diseases. Well, if you wouldn't eat those bag of Doritos every day, then you wouldn't have a problem. And not systemic in terms of, where is my access to a grocery store where I have access to fresh fruits and vegetables, or that I don't even know that the Black and brown children, and the data shows this, are disproportionately targeted for those junk food products. You can go on and show the systemic ways in which this works. So yes, it affects every aspect of our lives, and it needs to stop. It affects policing. That same attitude of disregard and is affecting our policemen white and Black, by the way, because then it becomes a systemic culture that when you go out on the street, instead of having the benefit of the doubt, instead of, innocent until proven guilty, instead of due process, what we have are men primarily making snap judgments to take the lives of people without them ever having a trial, without them ever having due process. They are the judge, jury, and executioner right there on a street corner. And this has to stop.
And I'll say a little bit about my role at the Public Service Center as Assistant Dean of our Social Innovation Programs. I manage the Ideas Social Innovation Challenge, a 20-year-old student social innovator program. And we fund, mentor, and we advise students from across the Institute who have societal challenges that they would like to tackle from anywhere in the world, and they can recruit a team from anywhere in the world. And the challenges the challenges that you've raised, Maya, are not just about specific health care and health access issues. We're looking at, as you mentioned, the physical and social determinants or correlates of health, which is every aspect of a person of color's well-being. It impacts that. So what would you say to a potential MIT student looking to formulate, to launch a social initiative? What would you say to them?
So let me just add to what you just said and say that the political determinants of health are just as important as well. And so with that, when you have policymakers having that infected vision of who's deserving and undeserving, then the communities that are considered undeserving don't get the resources that they deserve. We recently saw this play out in the US Census question on citizenship. And we then found out, the Supreme Court found out that there was a whole racist trail of evidence that they knew what the racial impact of that question would be. And so they were seeking to undermine the well-being of communities of color, Black and brown, because they wanted to increase the power of whites and increase the power of Republicans. And so politics is a dangerous game that also has an impact. Now, in terms of the students, we are at a technology conference today. And there is a lot that you can do, young people, to change the world. And there's a lot that technology can do, because listen, we're in the era of big data. And data is the key. I think it can be the key if we're careful to make sure that we address, disparities in treatment, disparities in healthcare, disparities in, the community resources and amenities with regards to how we actually invest our resources community-wide. And so with that, I mean, you can design all kinds of algorithms that are trained to actually look at the disparities, to see how wide the gaps are, come up with algorithms that actually, then flag for administrators or for policymakers, or, that you have a huge gap here. You need to pay attention to X. You need to pay attention to Y. If you are a hospital system, if you are a public health system, if you're a corporation of any kind, and you don't have race, ethnicity, gender, income as variables in the data systems that you're using to actually track the quality of your service, then this is just BS. You're just paying lip service to stuff. You're not seeking to do anything to make a difference, to change. And so for the students, the tools are at hand. You're using it for everything else. We now have Uber rides that can, figure out how to pick up people from across town and get them to where they need to go. We definitely have the ability, to close the gender and racial pay gap, because all somebody smart like you guys need to do is come up with the algorithm that companies can employ to actually look at the census of their companies to find out where the outliers are, where the disparities are, and to flag it for them so that they can address it. The same thing should happen in terms of healthcare. The same thing should happen in terms of public health.
Thank you for
thanks a
that,
lot.
Maya.
Thanks a lot for the comments. Maybe for the sake of time, we can move on to the Q&As, and we received some interesting questions. So one of the questions is for Rebecca. It's about what can MIT do to empower students and others to tackle these complex issues, because MIT is a tech university, and we need to think about the ways how we can actually approach these social problems with the tech solutions that we have in hand. And many people think that these problems are really complicated and the tech solutions are not enough for these problems.
Well, that's a great question, Imre. And actually, one of the words we've heard a lot are systems throughout today's sessions and comments, and systems can easily be a buzzword if it's not taught. So systems thinking, having people have a general understanding of that. And through the ideas challenge, the social innovation challenge, one of the things that I work to do with our students is that we really prod them to really think through the systemic issues, to understand who are the various stakeholders, what are the relationships amongst those stakeholders, and how do those relationships, power dynamics, resource flows, contribute to the challenge that is at hand. So that's one of the things that I know is taught in some respects, but not necessarily to social challenges. And I think we need to start there.
I think that another thing that can be done for students especially is that many of them, I used to teach at Purdue University. I also taught at American University in the Women's Studies Department and Political Science Department at Purdue. And, you know, a lot of these students are coming from areas of the country where there's no diversity. They don't even know that they have bias because they don't even, you know, they haven't had the experiences in life to actually, you know, reveal to them, you know, how their worldview might be narrowly shaped. And so helping incoming students and providing them with ongoing support and training to actually, you know, to to recognize and to help them identify their bias, and then to help them to figure out how to get beyond it so that they can actually work collaboratively with all kinds of people of all backgrounds, and more importantly, design systems, engineer systems and products and technologies that are unbiased. Because big danger with technology is that we can end up with unaware engineers, with unaware innovators. We can end up replicating the same negative, racist, sexist systems in the virtual world. And that would be the worst outcome, because I'm just like, okay, I thought technology was supposed to be the salvation. Now don't come at me with this racist application and tell me that I'm supposed to be embracing a tech future. I don't have anything to look for if we're talking about replicating the same bias systems in a tech future.
Right, particularly when we think about machine learning and those algorithms, and research is showing already that they're founded on bias and underrepresented data already. So there's certainly an opportunity for us to write some things there.
I think the main idea is to acknowledge the problem and understand it deeply, so that we don't actually perpetuate these ideas and racist thoughts in our technology. I have a question about how we can acknowledge these problems on a state level. One of the questions is about what should we expect from the states that declared racism as a public health crisis, and Massachusetts was one of the, I think, some of the locations in Massachusetts declared racism as a public health crisis. So what should we expect from those states and places that declared this?
So we should be expecting them to actually embrace health equity. We should, and that means that that they would be doing an equity audit of all of their programming, all of their investments, to understand where the flaws are, where the disparities are, and then coming up with an equitable strategy. And when I say equitable, I don't mean equal, I mean equitable, and this is the difference. Equity means that you actually invest more or come up with additional kinds of resources and strategies to help those who are the farthest away from the desired goal. It doesn't mean that everybody gets the same thing. It means that you're repairing the hole where you find it in order to bring everybody up to the same level. We know that some communities don't have the same standard of living as other communities. And that's been by design in terms of how racism has affected how we distribute resources and how we support or choose not to support different groups of people. But we have the choice to do better and to be better. And that choice, the first step in it is acknowledging it. And so I applaud those public health departments and those leaders who have declared racism as a public health problem, because it absolutely is a crisis. And now the next step is implementing systematic equity strategies. And that might include, in terms of policymakers, it might include targeted universal policies, meaning that there might be a policy that affects everyone when it comes to COVID-19, but there are going to be levers within that policy that specifically speak to the vulnerabilities of frontline workers, to the vulnerabilities of communities of color, to the vulnerabilities of low-income populations. That means that you have an equitable strategy, investing more resources where they're needed in order to make sure that everybody has the same kind of outcomes. That is where these states need to go.
Thanks,
And
Maya. Rebecca, go ahead, please.
yes, and it really does start with the data collection, and Maya had mentioned that earlier. So we really need our states to really be getting into our communities and getting the real story as well.
Thanks, Rebecca. For the sake of time, I think we should end this session. And thanks a lot for joining us. This was a really great fireside chat. Thanks again, Maya and Rebecca.
Thank you so much. It was a pleasure.